You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, everyone. Another episode of Stellar Success Podcast. Very interesting one. I'm happy to have a great guest today, Dr. Todd Otten from Michigan. So, how are you, Dr. Otten?
I am fantastic, and feel free to call me Todd or whatever you prefer.
Awesome. Thanks for being here with us. You have an interesting story and some projects that you're involved in. Can you tell us a little bit about yourself? What's your story? How did you start? And where are you now?
Oh, for sure. How much time do we have again? Just kidding. No, I think the story really gets interesting in 2019. I'm a family physician, and like many of us, I went through really pretty severe burnout during that year. I was ready to quit, and there was a lot that went into that. And there was a moment where some pay was withheld because I had a couple open charts, but fortunately, I got some time off, and it allowed me to think and get some counseling, which really helped. And then I came back and I vowed, well, we're never doing that again. And so I also vowed that wherever I landed, I was going to live the quadruple aim, which, as a quick reminder, I suppose, for the audience, it's patient experience, quality care, lower costs, but also that wellness piece, which is so critical to making the magic happen in delivering healthcare. Anyways, so I took over a clinic, and it was amazing. But again, another pivotal moment occurred in August of 2022 when I was basically told I was going to be relocated back to the town I had gotten burned out again. And unfortunately, I was in a position, due to some, I guess, savvy investing, if you will, to take a stand for myself, for my colleagues. And I resigned the next morning, which has led to an amazing journey in the last year and a half of finishing writing the book with my co-author Joshua Judy, Ripple of Change, but really getting involved in advocacy work, particularly with Medicine Forward. And then recently, I've joined a very progressive ER group in Grand Rapids, Michigan, emergency care specialist, who is physician-led, thinks outside of the box, is doing some amazing things in terms of improving care delivery, but also trying to lower the costs in doing so. So it's phenomenal. It's so much fun, and the culture's great, and it's a joy to be there. And so when I'm able to say that, it hopefully provides some hope to my colleagues that
Yeah.
they exist. They're out there. These groups do actually. I don't know what the word I'm looking for is. I guess I'm drawing a blank. But anyways, it's been amazing.
That's awesome. That's a great story. I want to kind of stop here and go deeper in what you said. The fact that, my podcast is called Stellar Success, and it's addressed to medical professionals like us. And it seems like your experience with different groups and different jobs led to failures that basically pushed you forward in discovering, some other opportunities, grow and take it from there. So I want to explore the fact and how did you deal with the risk of quitting, resigning, taking over again, restart. How do you deal with those things?
Oh wow. Yeah, I part of it is I would make the case that I have a very high risk tolerance, which is also part of the why, how I was able to have some financial success, making some calculated bets, if you will, on certain things early on in projects and in real estate and so on and so forth, allowed more of that financial freedom and that capacity to then, resign or take a stand, if you will. But it, oh my, it was not without a lot of lead up, if you will, that
Hmm.
decision. I had been thinking about it for a long time, and the things that were coming down from the administration were such that they weren't focusing on the right things. It was often related to money. And I was all about, frankly, trying to deliver high quality care. And so
Yeah.
I would push back. And I think, that's just how I'm wired. It takes courage. It takes commitment. It takes that risk tolerance, as I mentioned. But I think ultimately, we're in a unique position as physicians. I joke that many of us can literally throw a dart at a map and there's going to be a job wherever that
Yeah.
dart lands. And so I think knowing that, it says, okay, you know what? I can take that leap of faith and try something new and try something different. And I think that's important for our colleagues to realize that. And the other thing to double click on that maybe a little bit is this networking thing, right? With social media and LinkedIn and all these other tools that are out there and these amazing groups that can help you and support you, I think it becomes less scary, or can become less scary if you look for that. Another thing is coaching. A coaching is an amazing thing that I've started to utilize myself. And frankly, I wish I had done it maybe 10 or 15 years ago. But then maybe we wouldn't be having this conversation had I done
Yeah.
that.
I
So
totally agree with that.
yeah,
I,
yeah.
Yeah, I'm a big fan of coaching and mentors, especially in things that you're not very comfortable with. And another point that you made, and is very important, is this notion of trying things and getting out of your comfort zone, and try to get out there and try new exploring businesses or avenues for your own sake. Um, and one of the things that you mentioned is that you made some investments along the way, and you're happy with that. You know, the most important things, I think, for physicians is not that we're not making money. We're making good enough money, and we have good incomes in general as a profession, but we also spend a lot. So we came to a point that, at some point in life, we cannot practice anymore, and we have to rely on some passive income streams to bring us the financial security. In your case, what are those? What do you like to do in this field? Do you have any preferences in terms of investments or things that you like to get passive income from?
Oh, yeah, that's another wonderful thought. So the first one I would say is real estate. So when I got into not got into the Navy, when I was in the Navy, it was commonplace for individuals to buy a home and then when they relocated, to then rent it out. And so that was my first foray into that world. And there's so many opportunities there, whether you're talking about passive income or depreciation. And I'm not a real estate expert by any stretch of the imagination, but it got me started. And so that was one avenue that we had utilized from a passive income stream. And we've continued that throughout the years. And it's been successful in one facet or capacity, if you will. The other thing that was frankly a grand slam for me, and it was crypto. Cryptocurrency is an amazing asset class that I think really a lot of people truly don't understand what's going on there. Of
Yeah.
course, like anything else, there's a lot of garbage. I'm not going to sit here and say buy a meme coin, and if go ahead and look that up if you need to, or FOMO in, which is fear of missing out on something else. But for those projects that actually offer utility, and are trying to solve world problems using
Mhm.
blockchain technology, in that regard, there's a lot of opportunity there, and I did very well with that. And there's also opportunity for passive income streams that people potentially aren't aware of. The other thing too that you could talk about is writing a book or having other
Yeah.
content. I wouldn't suggest writing a book in hopes of becoming a millionaire, but certainly it opens a lot of doors and other opportunities in that regard. So those are just a few of
Great.
the things that I've gotten into that are along the passive income stream, if you will.
Yeah, that's awesome. I like your diversification, I would say, in those fields. And one thing that I love, it's real estate, and brought me a lot of passive income streams over the years. But it's hard for people to start in something like this. And you mentioned you bought your first home while you're in the Navy. Was this hard for you? was this a risk that you took at that point?
Oh, yeah, for sure. I mean, it's always a risk whenever you're talking dollars and cents and utilizing those as a vehicle potentially to create more. But if you get help and you get assistance or you talk to your colleagues, you don't have to do it alone, right? I think the best physicians, the best clinicians, the best entrepreneurs are the ones willing to say, you know what, I don't know, and I need help, and it's out there. Um, but back to the question, yeah, I this might go back to my poker playing days, where I started playing poker when I was a very young man and quickly realized that there's a lot more to it than luck. Right. And so that helped build my risk tolerance over the years. Right. Yeah. You put in, say you're playing a game and it's $5, right? But if the win is $100 as a result of that, that's a pretty good return. And so that started to wire my brain along those lines. Yeah, you're going to have losses, right? And you have to
Yeah.
understand that going into these positions. But if something goes up 10 times or 20 times or 30 times, or I'm not going to give you the total exponential that occurred with crypto, but then that allows you to dive into other opportunities. So I've been fortunate to get into some amazing companies early on as a result of that. And as physicians, we're all accredited investors too,
Yes.
most likely, which is huge. And so, are there companies that are looking for capital as an angel investor or an early round or what have you? So, yeah, it's a different way to think. I think I guess the point I would try to make is, the standard, hey, let's throw money into the stock market and earn 8 to 10% a year. That's okay if that's a portion of your portfolio, but I would really suggest people explore some of these other opportunities because they can be amazing.
Yeah, I agree with that. The risk to me to play the stock market is infinitely higher than other investments you just mentioned, actually, because I feel like I don't have any control of how the stock market is going. It's something on a bigger scale that I can think of, and I can put my finger on anything, either specific companies or mutual funds as a whole, or whatever, Elon Musk says one day or not. It's just something unpredictable.
I agree with you, actually. And I didn't even mention the fact that I've done quite well with comic books. Um,
Oh,
made
interesting.
quite a lot of money on comic books, which is a
Like, you mean
recall.
collecting them and selling?
Yes, actually, as a kid, I loved to read comic books and had a collection, kept it over the years, and then got reintroduced to it, if you will, maybe 7 or 8 years ago, but quickly realized that there is a market there. And I'm like, holy smokes, there is
Yeah,
some money to be made. And actually, it was that foray that led to an investment club that I'm involved with some friends. And a key component of that, which is one of the ways we cash flow, is buying and selling comic books and other collectibles and things.
very
It's
nice.
interesting. We got a group of physicians and lawyers and architects. It's a lot
Yeah,
of fun.
that's awesome. That's great. I want to kind of um, take a step aside and ask you a couple of things about how did you become successful in what you're doing? And, there are any skills or habits daily that you're doing that you think pushed you forward in your endeavors?
Oh, yeah, there's probably a couple things there. The first one, when my grandfather was passing away many years ago, he said to me, actually, I was volunteering at the hospital trying to get into medical school at the time. He had said to me, "Don't rest on your laurels," and I very much took those words to heart. And so, I think at times I'm never satisfied. Like many of us, we're always looking for a new challenge or a new opportunity, which is good and bad, right? I mean, I think there's that opportunity to slow down and be comfortable with what you've achieved and what you've done. But that's always driven me to sort of the next challenge. My wife jokes, she's like, "Oh, he's on to the next thing." He wrote the book, he's doing this, that, and the other things, on to the next thing. So I think that's part of it. But then there's another real key thing for me. When I was in college, I went to a Chinese restaurant. And I got a fortune cookie that said, "Your principles mean more to you than any money or success." And I have stayed true to that over the years, or at least I've tried to. And I think that's part of what gave me the courage to step away too, and to realize that there are going to be opportunities out there. Um, and you know what? It's been just a blessing, right? Like
Yeah.
rejoining this emergency, I shouldn't say rejoining, but I recently joined an emergency physician group earlier this year. And a big part of that was I realized that, yes, we can try and make change within our healthcare delivery system from the outside, but we also need to try and do it from the inside. And so, yeah, sure, I work part time, but as I said, they're doing amazing things. And it gives me that opportunity to try and improve things, change the status quo, challenge the status quo, think about things differently, continue to build the airplane as we're flying it, whatever analogy you want to use. Um, so, yeah, those are two big things that really led me to where I'm at now.
Awesome. Awesome. In your daily life, what are things that you're doing to keep yourself up on your toes? Habits, fitness, nutrition, exercising. Give us a glimpse of that.
For sure. Well, I'm not going to sit here and say I'm perfect with all that kind of stuff. I mean, we stop at the fast food place occasionally, but typically I would say we eat pretty healthy, fruits and veggies. Exercise, again, I'm not perfect, but I still play in the old man soccer league, the over 40 league, and I'm getting close to the over 50 league, as you can see by the gray hairs. So,
Awesome.
in a word, I would say balance, and I realize like you can't do everything.
Yeah.
You got to have the capacity to say no. And even in this advocacy work and this networking work, I'm realizing like, oh my goodness, like there's so much bandwidth we all have. And where do we want to focus our energy? And what are the things that fill up our cups? And if they don't, you got to say, well, should I be doing that? Is that where I should be spending my energy? And so to answer the question, I think in my life, I try and stick to balance, devote a certain amount of time to exercise, obviously devote a certain amount of time to my family, a certain amount of time to work, a certain amount of time to advocacy, so on and so forth. For example, later today, we're going to watch my oldest run his first cross country meet of the season. He's in college.
Awesome.
He's a he's a beast. I'll leave it at that. So his mile time's down to about 4:09. But you can see how it just lights me up just talking about it. So yeah,
Yeah,
balance for sure.
that's awesome, man. That's great. And you said something very important, the fact that many people don't know how to say no to things, and they don't have priorities, and they want to do different things all of a sudden. And I think one of the characteristic of a successful person is to know when to say no to things, and just prioritize your things in your life that move you forward.
Well, we're not trained that way, right? I mean,
Right.
it's just do more, check one more box, just say yes, keep going, compartmentalize, put it in a box,
Yeah.
patient first. And, that's all well and good till it's not, right? Which is why we've got this epidemic of, unfortunately, burnout or whatever you want to call it, this concept of moral injury, and God forbid, we talk about the physician suicide rate. I don't want to go down that
Yeah,
rabbit hole
it's
necessarily, but
something.
it's
Right.
crazy.
Yeah, I agree. It's something that hits us very hard, and this is one of the things that I'm trying to kind of educate people with, guests that I'm bringing on my podcast, and give them a glimpse of their experience, like yourself, and avoid that burnout. Um, because I found myself in a situation very similar to this, and I had to switch gears right away. But yeah, this is interesting. Tell us a little bit more about your projects right now. What are you involved in? What are you looking for? Anything that excites you?
Oh boy, how long's the show again? No, so probably a couple things. I'll go one related to the work that I'm doing with emergency care specialists, and then I'll jump over to medicine forward a little bit.
Hmm.
So emergency care specialists, as I said, is the ER group I work for, right? And so why does a family physician go work for an emergency physician group? as I said, they're doing innovative things. And one of the things that they're doing is called the Right Care Clinic. And we think about our traditional notion of urgent care, if you will, and then the emergency room. And really, if you think about it, there's kind of a gap there for
Hmm.
those higher acuity patients that need additional workup, additional treatment, but maybe they don't really need the emergency room. And so the Right Care Clinic is staffed by an ER physician. It's got an emergency room nurse, it's got a CT scanner, X-ray, moderately complex labs, IV fluids, IV medications, et cetera, but it's not an ER. And so these facility fees that come tethered to your as soon as you walk in the door to an emergency room aren't there. So you have this capacity to deliver higher acuity care, but at a fraction of the cost. It's been
Yeah.
incredible. And the primary care physicians, now that they're realizing what's happening here, are loving it. And I would have loved something like this when I was seeing patients full time, right? You have somebody with chest pain, their EKG is a little bit wonky, maybe. You need some troponins, maybe a chest x ray. What do you do? I mean, I can't draw troponins in my office,
Right.
and nor can 99.9% of other family physicians, most likely. So you send them to the ER. This is a way to address that without that huge expenditure. So it's just been an amazing journey, and it's brand new. So stay tuned. I think it's going to be very cool. The other thing that I'm involved with is more in the advocacy world with Medicine Forward. We recently had a retreat with the leadership, and we're working on refining the mission, if you will. But ultimately, it's going to be close to the following: to help physician patient relationships flourish, to move medicine forward. I wrote a book with a patient. Obviously, not everybody can write a book with a patient, but if we can heal that bond that is sacred, there is magic to come.
Yeah.
So that's the other one that just fills me up on a daily basis, that work, and trying to connect those physician groups with those patient groups and really facilitate hopefully a lot of positive change going forward.
That's great. That's great. I certainly want to read your book and probably recommend it to my audience, and I think everybody should take a look at that. It's an interesting concept to write a book with a patient. I've never heard of that, honestly, and I think the project was exciting, right?
Oh yeah. Well, yeah, 100%. It was an amazing journey. So, right, like initially when I started the book, it was somewhat cathartic for me. I was coming out of burnout, and I wrote about a chapter called Anatomy of Burnout, really walking the reader through what is it like when a physician's struggling, and what are all
Mhm.
the negative ripple effects that occur. I mean, it affects thousands of people if you think about it. I mean, thousands.
Yeah.
Um, but it took on a whole different trajectory when my co-author Joshua got involved. He had been struggling with his health, and I don't want to give away all the secrets, but one of my treatment plans to him was to just write, and he did, and it was good. We had a chat, and that led to us collaborating on the book, and from there it took on a very different path, if you will. And in
Interesting.
the end, it was cathartic for the both of us. And yeah, it's a longer book, but it's really two books in one if you think about it. You got my
Yeah.
story and his story, and the font's a little bit bigger because he's got a retinal issue, and so you factor all that in. I mean, we could have made it a thinner book, and maybe people wouldn't be quite as intimidated by it. But in the end, I think it's done what we hoped it would do,
Yeah.
which was to inspire people and help them feel empowered and offer them ideas and tips and tricks to navigate, frankly, the dysfunction that exists in our world in healthcare right now.
Yes.
And so we weave it back. Sorry if I'm going on too long. Sometimes I get excited talking about it, but we weave it back and forth in kind of a unique way. And so it was just a lot of fun to do the project for sure.
That's great. I really I'm looking forward to read that book. Um, Todd, how do you feed your mind every day? Any
Oh,
books, podcasts, anything that you're doing daily?
oh yeah. Oh boy. That's just a so thought provoking. For a long time, as a physician, I didn't read for pleasure. Long time. And I think I used the justification that I was always reading and writing at work.
Hmm.
Um, and maybe that was an excuse. As I got into the writing process, I started to read books a lot, actually, as fuel, if you will, ideas, so on and so forth. And so I think the biggest avenue for me for new ideas and how I consume things, if you will, is reading. And I've gotten into a habit of trading signed books with my colleagues. I've gotten a little ahead of myself in that regard. I have a whole stack I've got to get to, but that's my favorite way to consume things. I do a little bit of, I don't know, scrolling, if you will, and reading headlines and articles. And I do consume some podcasts on occasion. Um, Nothing with great regularity, if you will. I'm not necessarily a news guy. It's a bit sensationalized for me and maybe a bit polarizing. I don't feel like it's as constructive as perhaps it could be. So to actually answer your question, I would say reading books is my primary mechanism. But then the other thing too is talking to individuals
Yeah.
and learning from them, and asking questions and exploring and finding out, for example, before we started the conversation today, I was intrigued about your last name and wanted to know what the origin was and just simply asked. And then that leads to, and you learn that way,
Yeah,
just talking to other
absolutely.
individuals. So yeah, books and networking are probably my top two, if you
Yeah,
will.
that's great. It's definitely something that moves you forward, and I certainly believe that people that have read a lot of books are much more willing to explore new things, to get out of their comfort zone, to grow faster, to have a bigger horizon, I would say, of ideas. And it's something that I grew up with. I didn't have, I mean, I didn't have social media. We didn't have internet. Um, and I grew up in a country that didn't allow all of those things anyway. Um, so books were the only things that I put my hands on, and I kind of have a habit right now the same way like you do. Pick up anything that is helpful for my mind. Anything in particular in books that you like to read in terms of like business, personal development, economy, anything specific?
Well, historically, I would say I was into like the espionage thrillers, if you will. Recently, it's been heavy on healthcare reform. I think for probably obvious reasons.
Yeah,
But there's just some very unique approaches and ideas that are out there. Um, so that's probably the heaviest genre that I'm into
yeah,
right now. But yeah, historically, I would say, kind of the James Bond
right.
stuff was always fun and that. But yeah,
Yeah,
those are my favorites. There's a couple, actually, there's a few that have really stood out to me in the recent past. One is impact networks. There's some groups working to create impact networks within healthcare reform.
hmm,
And so that one stood out to me. Emily Peters wrote an amazing book talking about uh, utilizing art in rethinking healthcare. I really enjoyed that one. Uh, Recently read Robert Pearl's book, Chat GPT MD.
hmm,
That was interesting. And that one actually caught me a little bit off guard, some of the things that he was advocating for in the book, aside from generative AI. One was the importance of primary care. Obviously, I'm biased. I'm a family
yeah,
physician, so I totally believe in that. And I think most of our colleagues would agree. But the other thing, too, is the importance of physician leadership
yeah,
in writing the ship. And you might get some differing opinions on that, but I agree with that. I think we need physicians at the highest levels helping shape the decisions that are being made and how we turn this thing around. Who knows better how to deliver care than a physician? And again, of course, I'm biased. I'm a physician, right? So, obviously I'm going to say that, but we know what it takes. We know the time
yes.
required to do things the right way. And unfortunately, that's not what's happening in many instances. And so, yeah, those are just a few that are highlighted for me recently, if you will.
Yeah, that's great. Well, you touched on a subject that I discussed a lot with other people also. The fact that medical school in general doesn't have that component for us. They don't have any kind of courses in business development or healthcare environment or how to manage a practice or how to take over a practice. So there's nothing there we can learn from. And I would think that the only way probably to get into those details is to, like you mentioned, is to look for mentors that did this before. They can teach you, they can share their experience. But as you said, this is a very important field, because no matter how good we practice and how good are we with patients, if we don't practice in a system that is good, um, everything goes to dust, with healthcare. And it's funny because, coming from a different country, I always thought, and this is the view of the world of United States, right? We do have probably the best healthcare system in the world. Um, and so when you are here, you see the minute things that are not working properly. And I totally agree with you. There's so many things to change and to improve, but it's still something that to be grateful for on a bigger scale, the fact that we are here and we can possibly change the system from within, like you said.
Yeah, that would be my dream. I joke that I want to, Todd, why are you doing all this? What's your goal? And I joke, I want to boil the ocean. And everyone says, oh, you can't boil the ocean. And I always respond with, well, why not? Why can't we try? Maybe we do it one bucket at a time, right? I do a bucket, you do a bucket, everybody does a little bit of a bucket. I think you're
Yeah.
right. On a lot of levels, I do think we have incredible, amazing things that occur in this country within healthcare. But at large, we spend a lot of money and don't have the best results, if you will. And how do we move that needle?
Hmm.
I think that's the I guess, to coin a phrase or cliche or whatever, that's the $1 million question, or maybe it's the $1 trillion question we should be
Yeah.
asking, I suppose.
Right.
But I think it can be done, right? And you see these little pockets of amazing things that are happening, and these groups that are thinking about how do we weave in social determinants of health and make that part of healthcare delivery. And I think when we can sort of get our heads around that and do that at scale, it's going to be magic.
Hmm.
Interestingly enough, and I don't know if you know him, I got a friend, Mark Smiley, who's doing a lot of work in this regards with real estate. He's an ER physician, and
Hmm.
weaving all that together and blending it together so that the majority of stakeholders win, not just the minority. And
Yeah.
that's a big part of what we need to change, that
Awesome.
legacy minority that's winning in the current infrastructure.
That's
I
great.
might get in trouble for that one, but whatever.
Todd, if you would have to give yourself an advice or a piece of wisdom, looking back to yourself in the early years, what would you say to you?
I think we touched on it a little bit earlier with boundary setting and realizing that we all only have so much capacity.
Hmm.
At the peak of my productivity, if you will, and that's a trigger word for many of us anymore, I was seeing about 6,000 visits a year as a family physician, and I was chief of staff, and I was an ACO medical director, and I was a soccer coach, and I had 4 kids. And it's like, what are you? And then I suggested maybe I get a hobby, another hobby, and my wife looked at me like I had 3 heads. She's like, you don't need anything else to do. You got enough. And the point I'm trying to make is like, that's not balanced, right? And that's what leads many of us to getting in trouble.
Hmm.
So that art of saying no is critical. It is absolutely critical to set boundaries in your workplace, with your friends, whatever the case may be. To be sustainable, if you will. So that would be my number one piece of advice to a guy who had less gray hairs, 10 to 20 years ago.
That's great. Todd, I really appreciate you talking to me, and I think the audience will pick up some great advice from your experience. And I wish you good luck with the projects, and I can't wait to read your book also. We're gonna have to follow up at some point with you after you change the whole, you boil the whole ocean.
That sounds perfect. I appreciate you having me. Thank you so much.
Sure. Take care.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.